Good afternoon. Allegheny County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department, giving our every 2-week evaluation and update on the coronavirus pandemic. Our numbers here continue to be very, very good in Allegheny County, which is something everybody should be very pleased and proud to be where we are. We see around the country in many, many states an absolute explosion, if you will, another wave that's coming in places like Florida and Missouri and Mississippi, et cetera, where vaccination rates are much, much lower than what we've seen here. We know our vaccination rates are better than other places in the country, but they're still not where we would like to see them at this point, particularly among some of our younger population. So the numbers, again, have looked very, very good, and we want to continue along those lines. But to just think that this is over would be a little bit premature. With the variant that's out there, the Delta variant, and some of the other things that are happening, I think it is something that we still need to be concerned about. The other thing that concerned me this morning was to see that the death rate nationally was over 800 yesterday. So that is also going up in other parts of the country. Again, not here, and we're fortunate. We certainly don't want that to happen here in Allegheny County. So we still want to continue to follow the recommendations that Dr. Bogan and our health professionals continue to put out. I know we're feeling very good and optimistic, and we're out and about a lot more as things have opened up, certainly much more than they have been in the past. But again, we still have to be very, very cautious. We also have a significant number of our population, our under 12 population, that can't get vaccinated at this point, and we want to make sure that they're protected as well. So anyway, let me turn it over to Dr. Bogan to give her update and then take questions from the media. Dr. Bogan?
Thank you, County Executive. Good afternoon, and thank you for joining us. The daily average for new cases over the past 2 weeks has not changed. We continue to have about 10 to 15 new cases a day. Our positivity rates, new hospitalizations, and deaths remain low. And while these numbers have not changed, others have. Last Friday, the state updated their vaccine dashboard to reflect the state's efforts to deduplicate data and to improve first and second dose matching. The updated data provide a more accurate picture of vaccination rates, not only here in Allegheny County, but across the state. So what did we learn? The updated data show that 66% of all Allegheny County residents 10 or older are at least partially vaccinated, and just over 60% are fully vaccinated. The updated numbers reflect a lower rate of Allegheny County residents who are partially vaccinated, but a higher rate of residents that are fully vaccinated. What it means to me is that we still have work to do to get more people vaccinated in the county. Our team is waiting for an updated data set from the state so we can dive into the details to really better identify communities and areas that have lower rates of vaccination than others. And that allows us to target specific areas and populations. I really don't think that vaccine access is the main issue anymore. We now have many vaccine providers and events widely available across the county. Almost all sites and providers allow walk-ins. They have evening and extended hours. So the issue now is getting accurate information into the hands of trusted messengers into those communities that have lower rates of vaccination. Again, I touched on this during the last briefing, but it's worth repeating. We really are striving for equity in our vaccination efforts. And we are very grateful to the many organizations across the county who are working to address equity in vaccination efforts. For example, the federally qualified health centers, all the healthcare organizations, universities, pharmacies, the Black Equity Coalition, faith-based organizations, and so many others. I do want to remind the public that if you know someone who wants a vaccine but is having issues with access, to please have them call 211. 211 can help with scheduling homebound individuals. They can help people find a vaccine provider near them, and they can help arrange transportation to the vaccine site. The big challenge we have is countering misinformation that is swirling out there that results in people choosing not to get vaccinated. Recent news articles have noted worries among young adults, including the vaccine science is, quote, unproven, the vaccines cause infertility, They're waiting to see what the long-term effects of the vaccine are, etc. We have answers and data to address all of these questions and concerns. Vaccine science data are clear. The risks associated with COVID disease are many times greater than the tiny risks associated with the vaccines themselves, even for young and healthy people. As for long-term effects of vaccines, I will remind you that up to 10% of people, including young, healthy people, will get COVID long-haul syndrome. The symptoms vary widely, but include things like extreme fatigue, headache, vertigo, shortness of breath, changes in mood, and many other things. And this happens even among people who had only mild symptoms or no symptoms at all when they had their acute illness. We are a country with deep-held individual rights beliefs. But given that we are in a worldwide pandemic, I ask us all to consider how our individual decisions impact those around us. By choosing not to get vaccinated, we are putting others at risk who can't get vaccinated, including people with underlying health conditions and children under 12 who are not yet eligible to be vaccinated. As I've said many times, the vaccines work. Here in Allegheny County, among the 163 COVID-related deaths from April to June, at least 93% were unvaccinated or only partially vaccinated. In other words, nearly all people who are vaccinated are protected from death and serious illness from this virus. So I encourage you and people all to read widely the available data and not to rely on social media or your friends as the only source of information. Really dive into the details, read the data, and be informed. I'll end with another call to action. If you or anyone who needs help or guidance on getting a vaccine, please call 211. We will help in any way we can. With that, I'll open it to questions, and thank you all for your patience. Please be safe and be kind.
Our first topic comes from numerous members of the community who have called and emailed the health department. What can you share regarding CDC recommendations about masks in schools and summer camps and how the health department deals with calls like those?
Yeah, that's a really important question. We have been taking quite a few calls about that. So when we get these calls, the staff first provides parents with some background information, or the person who's calling, and to remind that the CDC doesn't really issue mandates, but rather recommendations. At this time, the CDC recommends that unvaccinated people, which as I mentioned earlier includes everyone under 12, that wears masks when they're indoors. It is up to individual organizations whether to follow those recommendations, so schools and summer camps have to make their own decisions. As for the Allegheny County Health Department, we encourage everyone to follow the CDC recommendations, including the masking recommendations. The CDC recommendations are based on the best available scientific data at a given time, and that's why they change over time. So until all children get vaccinated, we continue to advise that people follow the CDC recommendations and wear masks when indoors at camps and schools.
The next question comes from Pittsburgh Business Times. Can you provide an update on the Delta variant in Allegheny County?
Excuse me, yes. So the Delta variant is here, as we've said, but so far, Allegheny County has really not seen a huge jump in our infection rates that other areas have seen related to the Delta virus. To date, we have documented 9 cases of the Delta variant, but they date back as far as, and they spread across March, April, May, et cetera. If we look at how the variant has really played out in other areas, of course, it concerns me, but at this point, we haven't seen that impact here locally. But it is another reason to go get your vaccine.
The next set of questions comes from the Pittsburgh Business Times. Where are the new cases coming from? Are they mostly vaccinated or unvaccinated people? What type of cases are they, and how did they contract COVID?
So most of the cases are among unvaccinated. The current cases really report, like they have at other times when we've reported these data, attending mass gatherings like weddings, funerals, parties, concerts, sporting events. We've had a couple of cases from childcare and summer camps, but it's really a variety of locations. There's not one particular source of the infections that we're seeing at this point.
The next question is from KDK Radio and the Post-Gazette. Given the Delta variant and the recent 4th of July holiday, is the health department concerned about an uptick in cases of COVID-19, especially as other major cities across the nation have started to see that trend?
So as you can imagine, we are watching the numbers every day and we look at them closely. Today, we did see a jump in cases. We have 55 cases reported over 48 hours. So again, but that's 2 days of data over, and that does not make a trend. So we're basically going to follow the data and see what happens and keep you informed through our various methods to make sure you're aware as well. So it's really a wait and see.
And this is our final question again from the Pittsburgh Business Times. Dr. Bogan mentioned in the Board of Health meeting today the higher case rates around the country. What concerns do you have about county residents on vacation or on business travel elsewhere around the U.S. Returning and bringing COVID and the Delta variant back here, much like what happened last year?
So as I said at the Board of Health meeting, this is a worldwide pandemic. And by nature, what happens elsewhere in the world will likely impact us here too. So the higher our vaccination rates, the fewer people who are able to spread the virus, and that will reduce our spread here. So really the key to not being impacted by the changes happening around the world or even in other states around us is to get more people vaccinated. I do ask that when people travel, that they follow the CDC recommendations on masking. There is a mask requirement on public transportation, so planes, trains, automobiles, buses, school buses, so to remind people to wear their masks when they're on transportation, and also to remind people when they come back from travel, if they're sick, to please go get tested. Again, our positivity rates are really low, so only now about 1 in 100 tests come back positive, but it's important to know if you are positive so that you can refrain from exposing other people and spreading it. So I think if everyone follows the guidance, we won't see what happened last summer happening now with all the travel going on.
And that was the final question, if there are any closing remarks.
Thank you, Dr. Bogan, for those good words and the good report, and certainly the recommendations. But I think the message we still want to get out is that, while we haven't been talking about this nearly as much as we did previously, as we're heading in with good numbers, we know that this virus is still there, but we know how to beat it. It's vaccinations. The more vaccines that we get in arms in people, the more protection we'll have, particularly those folks who can't get a vaccine because of underlying health conditions or under the age of 12. And we don't live in a bubble. So those things that are happening in other states that aren't doing so well eventually will be here as people travel and people come in contact with others. So the evidence is so overwhelming at this point. I saw a statistic this morning that the death rate, 99.2% of the people who have succumbed recently are people that are unvaccinated. So 0.8% of the deaths have happened for people that have been vaccinated. So, I mean, I can't think of any statistic that would be as overwhelming as that to show the proof that vaccines work. And let's get everybody protected and let's beat this thing. We've got it on the run, and let's, I hate to say it, but let's finish it off. So anyway, we'll be back in a couple of weeks. As Dr. Bogan said, we continue to monitor very closely here at the health department to make sure we're protecting people and not get too complacent, and everybody be safe. Thank you.
Our next scheduled briefing is Wednesday, July 28th, 2021 at 4 p.m. Thank you for joining us.